SPAR trial's looking to see whether one of the cholesterol-lowering drugs, simvastatin, can help radiation work better and reduce its side effects. In this study, we're looking at people with rectal cancer. So the standard treatment for that is about 5.5 weeks of chemotherapy combined with radiation. In the SPAR trial, what we're doing is randomising patients so that half the people get to take a simvastatin capsule every day. The other half will get a placebo capsule each day, and neither the patients nor the staff looking after them will know which is which. So people take a capsule once a day starting a week before their chemo radiation, just so we can make sure they're tolerating it without problems, which most people do. Then they'll take it for a total of 3 months. Okay, so the radiation and chemotherapy starts a week into it. That lasts about 5.5, 6 weeks, and then they'll have another 6 weeks of taking the study medication after that. 6 weeks after they finish a chemo and radiation, we're going to be doing an MRI scan of the pelvis to see how well the tumours responded to chemotherapy and radiation. And then patients are going to have the surgery. So they would normally have surgery somewhere around 6 to 8 weeks after chemotherapy and radiation. So we don't change any of the standard treatments that people have for rectal cancer in this trial. We're just putting the simvastatin or the placebo on top so we can see if the statin does improve how effectively radiation works while reducing the side effects, both short-term and long-term. In terms of long-term follow-up, people are just having standard follow-up with their surgeons, and we're collecting data on how they're doing 1, 2 and 3 years after they finish treatment. The reason we're doing the trial is because a number of different groups around the world have looked back at patients with rectal cancer who are having chemotherapy and radiation and noticed that those who were taking statins appeared to have better outcomes than those who weren't. It's also true for a number of other drugs as well, but statins appeared to have the biggest effect, and it was the most commonly found drug that seemed to improve outcomes across different types of cancers treated with radiation. There's also evidence that people who've got cancer who are on statins survive longer than people who aren't taking statins. So the data supported pretty strongly that simvastatin or one of the other statin drugs could be a very useful thing to be taking. But the only way we can tell is to take people who aren't already on a statin and randomise them so half get it, half don't, and we can see whether or not it makes a useful difference. We don't expect people are going to be disadvantaged by taking a statin. Most people have no side effects, or at most perhaps mild fatigue with it. If people are running into big problems taking the statins, we're going to stop it, and they'll continue with their standard treatment. So at the end of this, we hope that we can see whether people do appear to get much better responses, much better regression of their tumours with chemotherapy and radiation with a statin, and if it also helps prevent some of the short and long-term side effects of those cancer treatments. If it does, then the important thing we're going to need to do is say, well, what difference does it make 5 or 10 years down the line? And for that, we're going to need to join up with other partners around the world and run a much bigger randomised trial to say, does it result in more people being alive and well without cancer back or without serious side effects of radiation, in particular, long term? And if that is true, then we also have the potential to start doing trials in people having radiation to other areas of the body for other cancers like breast cancer, cervix, prostate, bladder, lung, brain, pretty much everything really, and randomise them people to having statins or not. So this study is the first randomised trial looking to see if statins make a difference when given to people with having radiation and chemotherapy. If it works out, if it shows it really does benefit people, then it's going to be something which can be used worldwide in virtually every type of cancer long term. So quick, simple, cheap. People with rectal cancer who have been recommended a combination of chemotherapy and radiation for the rectal cancer, which is standard treatment for people with more locally advanced cancers there, they'd be eligible. They can't already be taking statins, and they have to otherwise be reasonably healthy and, liver and kidneys and blood counts and everything okay. Can't be pregnant or breastfeeding, but you shouldn't be anyway if you're having those sort of treatments for rectal cancer. But pretty much it's not a restrictive trial. We think it'll apply to most people. Age is not a problem. There are people in their teenage years through to people in their 80s or whatever who are having this sort of treatment for rectal cancer, and I would anticipate all of them would be eligible for the trial apart from those taking statins already for cholesterol. I'm hoping that people get through their treatment more easily and have less problem long-term from the radiation, which sometimes gives people stomach cramps or loose stools or bleeding. There's a number of other problems, including some more serious complications with scarring in the belly or the bowel. So hopefully less of that, but also getting through treatment more easily with less in the way of diarrhea and stomach cramps and feeling sick and unwell during treatment. The majority of people get through reasonably well, but if we can improve that, then it would make it much easier for people to get through, and people are going to be less anxious about having this sort of treatment. Clinical trials are really the only way in which we can really show that a particular treatment is working better than the standard treatment. The question, why do a clinical trial? Well, if you're happy with the current standards of care and what you're achieving, you don't need to do a trial. But there's a desperate need for better treatments and better long-term outcomes. Not just more effective, but also much more tolerable. And that people don't hopefully have the long-term side effects. So there's a crying need for better treatments. The only reliable way of showing that the treatments we're changing to are actually more effective is to do a trial. So the investment now will help us work out what does and doesn't help for patients long term. Okay? Short-term pain, long-term gain.